I wanted to take a moment to discuss probably the worst piece of legislation that has been ever passed or proposed in the modern history of the United States of America. And that's the Republican health care bill. And my concern is that this bill, if the present process continues, in which Mitch McConnell, the leader of the Senate, is talking to Republicans behind closed doors, it is possible that this major piece of legislation, which impacts 1/6 of the economy of the United States and every single person, could pass without any public serious discussion, without any hearings, without the Republican leadership bringing the doctors and the nurses and the hospital leaders and the insurance companies, all of those people who are involved in healthcare. They're not going to get a chance to even comment on this legislation. Now, how crazy is that? What all of you should understand is that the current bill, the bill that passed the House and the current bill being debated in the Senate, is opposed by virtually every major organization that is involved in healthcare in this country. Republicans are trying to pass legislation where every major organization that knows something about the issue is opposed, not to mention over 80% of the American people being opposed to this legislation. And just some of the groups that are opposed to it are the AARP, the largest senior group in the country, the American Hospital Association, the American Medical Association. These are our doctors. They're opposed to this legislation. The American Cancer Society, the American Heart Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Psychiatric Association, the Federation of American Hospitals, the Catholic Health Association, the American Lung Association, Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, and the American Nurses Association. All of them are opposed to this legislation. And what we have now is Leader McConnell, Senator McConnell, in the back room trying to buy votes from other Republican senators. And what I've done today is written a letter to the chairman of the Health Education Labor Committee, Senator Lamar Alexander, and I'm a member of that committee. And what I've said is, Senator Alexander, the American people want hearings on this issue. They want to know what is in the bill. They want to know what its impact will be on their lives. And we may disagree about where we want to go on health care, but we should not disagree about the need for open discussion. The American people want to know why the Trump-McConnell health care bill, the bill that we're looking at right now, being worked on as we speak, should be rushed through Congress without hearings when it would cause, according to numerous studies, not Bernie Sanders, numerous studies, the needless deaths of many thousands of Americans. Let me repeat that. Many thousands of people will die. And that's what scientific studies are telling us if this legislation is passed. Some of the estimates say that if 23 million people are thrown off of health insurance, over 20,000 people each year will die. Now, don't you think when we're dealing with that maybe we might want to have some public discussions and hear what the people of this country want? The American people want to understand why this so-called health care bill should be rushed through Congress when it would provide $500 billion in tax breaks to the richest 2% and to large insurance companies and drug companies. Is that really what we want to be doing in a health care bill? Huge tax breaks for the rich? I don't think that's where the American people want this bill to go, but let's have open discussions about it. The American people and groups like the AARP want to understand why it is that if this bill is passed, older Americans, people in their 60s, will suddenly find them paying 5 times more for their health care as will anyone else. And what we have seen are some indications that this bill will raise health care premiums for older workers by 3 or 4 times. Hey, Republicans, let's discuss that issue and see if that's what older workers, working class people in this country really want. The American people want to discuss the impact of massive cuts in Medicaid on nursing home care. How many seniors and people with disabilities will be thrown out of their nursing home? Where do they go? Who pays for their care? I think that's a legitimate question. And I would hope that Senator Alexander chairman of the Health, Education, Labor, Pension Committee, would allow us the opportunity to discuss that issue. The American people want to know what impact this bill will have on the horrific opioid epidemic that we are seeing all over this country, hitting Vermont, hitting West Virginia, New Hampshire, states all over this country. What happens if you make massive cuts to Medicaid? How does that impact the hundreds of thousands of Americans who would lose the substance abuse treatment that they currently have? The American people want to know what the impact of this legislation would be for the 2.5 million women who today go to Planned Parenthood. They get their health care at Planned Parenthood. This legislation says, sorry, you're not going to go to Planned Parenthood anymore. Well, where are you going to go? Is that appropriate to tell 2.5 million women that they don't have their choice of health care provider? The American people want to know how this legislation would impact the obscenity of people being denied health insurance because of so-called pre-existing conditions. The Affordable Care Act did away with that. This bill would take us back to those days when the insurance companies could say, oh, you have cancer, you have heart disease. No, we're not going to provide insurance to you. What impact does that have on this country? The American people would like to know, at a time when we're paying the highest prices in the world for prescription drugs, what this bill does to lower the cost of prescription drugs. And the answer is, as currently written, it does nothing. You're still going to end up paying far more for the same exact drugs that are being sold all over the rest of the world. So I would hope that Senator Alexander and Senator McConnell will have the guts to say, okay, we may disagree on where we want to go in healthcare, but at least have an open debate. Don't make these decisions which impact all of us and a huge part of our economy behind closed doors. That is really pretty crazy. Now, I myself understand, as I think everybody in the Senate does, the Affordable Care Act, so-called Obamacare, is far from perfect. Deductibles are too high, co-payments are too high, premiums are too high, prescription drug costs are too high. So what sensible people do is say, okay, these are the problems. Let's put them on the table. Let's discuss where we want to go. Now, my own view is long-term where we want to go, and you've heard me say this a million times, is we need to follow every other major country on earth and guarantee health care to all people in our country through a Medicare for All single-payer program. Short-term, in order to fix the Affordable Care Act, I think we should lower the eligibility age for Medicare to 55, currently at 65. I think we should establish a public option in every state in this country. If you don't like what the private insurance companies are giving you, you'll have a public insurance plan. And thirdly, we need strong legislation to lower the cost of prescription drugs. Will that solve all of the problems? No, it won't. But it'll be a step forward. Bottom line is, and what I'm appealing to Senator Alexander to do, is when you have an issue that impacts all of us, and 1/6 of our economy, we cannot continue a process in which Mitch McConnell is negotiating with that Republican there, behind closed doors. This issue is too significant. It has to be done out in the open. We have to hear from the stakeholders. We have to hear from the American people. Senator Alexander, do the right thing on this thing. And that is, let's start having some hearings, and let's involve the American people in the process of where we go forward on health care. And in my view, that certainly means defeating this disastrous bill that is currently before us. Thank you all very much.